Hey guys and gals, what's going on? Here you go is another one. Back fusion number 2. For me, it's been about 9 years apart. And if you watch any of my videos, you know this was the last resort for me. But I did want to post and update anybody curious about a fusion period. This would be an L4-L5 fusion. I had an L5S1 about 9 years ago. You can see it in my videos. And so what happened was I've ruptured 2 discs in the past, and they never really fixed the L4-L5. They fixed the L5S1 on the first fusion, and this has been a very bad, painful thing that I've been dealing with for almost a decade now. And on my other videos, you see I did, I did PRP directly into the disc. That was $3,000. It did nothing for me. I did stem cells in Mexico. That was $7,000. It did nothing for me. I did other ablations, injections. I did the Intercept method. If you look it up, it's called the Intercept. And so they basically do an ablation in your vertebrae instead of your disc, and it's supposed to, if you have vertebral pain or intradiscal pain, which you can look that up too, but vertebral pain would be just the bones are hurting. Discal would be your disc is a problem. My disc has been the problem. So we did everything. I even did human growth hormone injections. I did testosterone replacement. I did everything. And so we are finally at the point, I'm 44 years old. We had to get it done. I am 1 month post-op right now, 1 month and a couple days. I didn't even stay overnight. I got up compared to the first one, this was a walk in the park. I mean, they went through my side. So they did a T-lift. And then they did my left side screws. I already had screws on the right from the other vertebrae down, so I just said do the 2 screws on the left. And then they put the big fat fake disc in the L4-L5. And I knew right away the pain was different and better. We kind of had a little bit of there's ups and downs. I probably went too hard like yesterday trying to walk around too much, or even just being on my feet too long. Kind of felt some soreness yesterday. We're only a month post-op, so but anyways, I didn't want to make this too long. I just want to update everybody. I was out of the hospital the first day. I didn't even stay overnight. I got up and I'm like, I'm good, let's go. I don't want to stay in a hospital. I can get up. When you do it a second time, you just kind of know what's going to happen. I also had a knee replacement about 5 years ago, a meniscus implant that totally failed, and that's all in my videos too. So it's been crazy last decade, the pain and dealing with it, and my wife and what she puts up with, and my kids. It's all, they all have to deal with it with you. It's really hard, but I did everything I can. I'm at peace with that. I was ready to do it. I was afraid, of course. I didn't want to do it because there is a recovery. You're going to have to, there's never going to be a perfect time. I'm 44 years old. I don't want to do this now. I'm just so young going through all of this, but I feel like the pain's already better. I feel like so what happens is they compress one of your nerve roots. On my first one, they compressed my L5, my L5S1. They compress a nerve root, which caused all the fire in your foot. In my foot, my right foot was on fire for 6 weeks. I had to ice it every day all the time, and that just suddenly went away. Now my left foot is achy all the time. It's getting better and better every day. I had this crazy pain in my hip, the psoas major muscle they go through, the gluteus minimus they go through. They cut all through that. So yeah, overall I feel better. I feel like, okay, this could be a positive. There hasn't been a lot of hope in the last 10 years doing all of these other interventions and out-of-pocket, modalities and methods to try to ease this pain. The problem's always been the disc. It took him an hour just to dig the disc out. He had another guy do the screws because it was going to take so long. I was in there for about 3 hours. And I'm happy so far. The whole purpose of a fusion is to get the screws, and so you can fuse your bones together, and there can be, the disc was a problem. So I've had no disc in my L4-L5 for almost a decade. It's just been pain every night. So I felt right away after the first night I was sleeping better. I knew it had changed, but then you got to wait and make sure. So I wanted to make a video after a month and just update anybody that's curious. I'm positive so far. That's why I did another one. I felt like the first one was a success. I never thought it was because I always had pain, but why they never did the L4-L5 with it or just did a disc replacement, I will never know. I was 35 years old. What do I know? It's hard to really trust doctors and know what they're telling you. You got to do your own research. You've got to be a smart patient or client, as I call ourselves. We are clients. You can take every drug, it's not going to help. I mean, so we're happy, we're hopeful now again. We kind of feel like, okay, and there's going to be ups and downs with the pain, especially first few days, first few weeks. They don't want you to do anything for 2 months. They don't want you to bend for a month. That's impossible. You're going to bend. You got to use your knees and bend at your knees, and obviously, stuff that you don't bend over and pick up 50 pounds when you're 6'2" like me. You're silly. So you gotta get a grabber and grab things off the ground with it. And I hope in a month I'll be even more excited. I feel like we're on the right path finally. But this had to be done. It sucks. I don't want anybody to have to get a fusion, but we went through everything. Back against the wall. We did everything out of pocket you can do. There's nothing else. I tried to do clinical trials. They wouldn't accept me because my back was so terrible. They're like, hey, you can't do clinical trials. So there was nothing left for us. Anyways, so this is a positive video, believe it or not. And I just want to make sure that anybody that wants to do one, I feel like if you've done everything you can, do it. If you've dealt with the pain long enough, it's a success. It's a success. Research your doctor. I'm in Northern California. The guy did it. It's a good doctor. But his whole nucleus, the people around him are awful. The office is terrible. I think that's kind of nowadays. You got to wait 3 or 4 months just to see a orthopedic surgeon. It's wild. But you got to find a good doctor, and that's all I want. I just want a guy to do it, get it done, and here we are. So on the track to recovery. Maybe this is a new season for my life. Maybe I finally get some hope again, for a long-term hope, and I don't have chronic pain and a lot of dark places when you're in that kind of pain. And then you have in the middle, you have a knee replacement that's completely failed and infected and blood clots, and it's been wild, man. So I just want to say this is hopeful, positive thing. If you have any questions, let me know. I didn't want to make this so long, so I'll get off of here. But thank you for watching. Let me know if you got questions. I'm always open and seeing if anybody has any of the same kind of story. But thank you for watching. I'm glad. Appreciate you tuning in, and we'll catch you on the next one. Bye, guys and girls. See ya.